Odyssey from Plain Healthcare is intuitive pre-diagnosis clinical decision support software that delivers rapid, safe assessment and advice. It's fast and user-friendly, but more importantly, it's clinically thorough and safe. Odyssey allows users to operate using their own experience and style of communication within the framework of an objective decision support system. It provides a number of permission-related facilities appropriate to the user's role. In this introduction, we'll be looking at two products from the range: Odyssey TeleAssess and Odyssey Reception. Non-clinical receptionists and call handlers can prioritise queues quickly using the Odyssey Reception question sets to identify and filter out potential emergencies, onward referrals, or those that need to be called later by the clinician. Clinicians have access to more detailed clinical question sets that allow them to assess and prioritise patients comprehensively according to the severity of their presented symptoms. Locally configurable outcomes will range from patient self-care to referrals on to care by doctors or hospital emergency departments. First of all, its bank of clinical data is constantly updated and maintained at the forefront of best practice. Users have described it as like always having the ultimate medical textbook automatically open at the correct page to each patient's needs. Secondly, its structure enables a clinician to interact intuitively with the question sets that emerge during a consultation to reach consistently accurate clinical decisions, freely combining their own experience with the system's built-in protocols and advice. Using Odyssey, more than 50% of callers are likely to be triaged as having problems that can be appropriately handled by patients themselves or by referral to routine care facilities. The features and benefits of Odyssey TeleAssess are essential for 21st century medical telephone assessment. As the demand for urgent assessment and advice increase, it's essential that a high proportion of calls are safely handled without referral to overstretched clinical services. Clinical governance demands consistency, reliability and safety, and Odyssey TeleAssess meets this demand by ensuring that each patient receives optimal assessment and advice. Odyssey TeleAssess can stand alone or integrate seamlessly with existing patient record systems. At the same time, its web-based design allows easy deployment and maintenance. High-quality e-learning materials can be downloaded to quickly and effectively teach new users how to use the system. More advanced learning is supported by an online virtual learning environment with access to learning modules, a discussion forum, mentorship, and expert advice. Our customers tell us that Odyssey TeleAssess is the best in the market. It's fast. Most calls can be safely managed within 5 to 6 minutes, so patients are not kept waiting longer than necessary and services can optimize efficiency. It's safe. It prevents errors of omission or oversight, and the clinical content database is updated regularly, so clinicians always have up-to-date information and advice at their fingertips. It's thorough. 1 million words covering over 450 question sets, nearly 50,000 potential responses, and 20,000 lines of self-care advice are all interlinked, allowing users to escalate and prioritize quickly, so patients get the attention and information that they need. It's consistent. All users are presented with the same information and prompts to ensure that every patient receives the same standard of care. It's auditable. The data that has informed the clinician's decision-making are all easily recorded, so providing a contemporaneous, complete audit trail. So if queries do arise, the records help justify the decisions. Remember, Odyssey TeleAssess provides decision support. It's not a diagnostic tool. The user remains responsible and accountable for the decisions they make. No other clinical decision support software works better than Odyssey. Supported by our outstanding training materials, clinicians integrate Odyssey into their normal consultation style and always retain full control. It does not impose an unnatural approach to the consultation. Because it encourages open, patient-centered questioning and advice giving, patients are highly satisfied. Because data may be added in any order to suit the specific needs of each patient encounter, and the rate of progress through the various stages is always within the clinician's control. And finally, because this promotes rapid assessments without compromising safety or patient experience.